So today we're going to talk about inflammation. So reducing inflammation is a really key part of the Eat Better, Feel Better plan because so many of the members on there have issues that are actually, without them even realizing it, are being driven by inflammation to some degree or another. So stage 2 of the Eat Better, Feel Better plan, Renourish and Relieve, looks at reducing inflammation. So why is inflammation such a key area to address? So inflammation is a really common driver of a lot of issues that people complain about, women complain about in my group all the time. So things like high cholesterol, high blood pressure, heart disease, any kind of cardiovascular disease. If you go back down to the root cause, inflammation is a big part of that. Inflammation can also drive things like diabetes and prediabetes and insulin resistance. It could drive obesity, so things like weight gain, particularly in menopause and perimenopause, where we start to get that little muffin top and we carry a little bit of extra fat around our bellies. That can be caused by inflammation. Obesity in general, at different ages can also be caused by inflammation. And certainly the two of them go hand in hand. Somebody with obesity is going to have high inflammation, and somebody with high inflammation is likely to be overweight. Hormone imbalances are also driven by inflammation a lot of the time. So things like endometriosis and fibroids, inflammatory processes are really at play there. Gut health, again, things like IBS, leaky gut, food intolerances, inflammation is a key driver. So inflammatory conditions in the gut are what's driving a lot of common digestive issues and complaints that I see all the time. Autoimmune conditions, again, inflammation is a natural part of our immune system. It's the way our body protects itself. But when that goes out of kilter and we have too much inflammation, the immune system can go into overdrive, and that can trigger a lot of autoimmune conditions. And then also things like even your mental well-being can in part be impacted and affected by inflammation, especially sort of the chronic low-level inflammation that I'm talking about today. So let's start by looking at what exactly I mean by inflammation. So first of all, I want to say that some inflammation to some point is actually good for us. So inflammation is our body, our immune system's natural way of protecting itself. When there is a trauma to the body, so maybe an injury or an infection of some kind, inflammation is what tells your immune system, right, there's something wrong here. We need to send all the white blood cells and all the immune cells to this site, to this part of the body to make it better. So you'll get swelling, you'll get heat, you'll get a temperature, bruising, all these kind of things are signs of inflammation, and they're good signs. They're signs that your immune system is doing what it's meant to do, it's protecting you. But this is meant to be temporary. And the problem is that nowadays in this modern world, we live in a state of chronic low-level inflammation all the time. So basically, our lifestyles when we were sort of cavemen and cave women, and we were living, a very sort of natural, outdoors, very sort of clean lifestyle, really, how we were meant to live. Inflammation would only really take place when our body was in fight and flight mode due to maybe a life or death situation, a real threat, an injury, maybe some kind of infection, something like that. But nowadays, our modern lifestyles mean that we've got these stresses on our body all the time. So things like stress from our lifestyles that I've already mentioned, so things like maybe rushing to meet deadlines, rushing in traffic, watching stressful things on TV, money worries, relationship worries, worrying about aging parents, worrying about moody teenagers, worrying about what you're going to make for dinner that night. All these different things can actually cause a spike in our cortisol in our body, and that can drive inflammation. Also, our diets can cause a lot of issues with inflammation. So a lot of the foods that we're eating now that we're not meant to be sort of really eating drive a lot of inflammatory processes in the body. So if we think about ultra processed foods, they're full of a lot of inflammatory fats. So things like trans fats and vegetable oils and things like that, they can be really inflammatory on the body. They can cause a lot of issues for us. And also in these processed foods, you tend to find there's a lot of chemicals and additives and emulsifiers and things like that. And they can also, they at the end of the day, they're chemicals. They're not naturally found in our food. And so when they come into our bloodstream, the body's like, oh, what's this? This isn't meant to be here. And so it creates an inflammatory response to help our bodies remove this toxin. But if you think that we're eating these foods day in, day out, obviously this is driving this chronic inflammation all the time. Also things like dairy and gluten. So even though technically dairy and gluten are parts of like our natural foods, our whole foods that we can eat, a lot of us as we get older, we lose the enzymes and the abilities to break down and digest these foods efficiently, and therefore they can cause inflammation in the body. So things like dairy, we're meant to have an enzyme to break down the sugar in dairy called lactase, but genetically, a lot of us lose that enzyme as we get older, and so therefore dairy can become quite inflammatory in the body because we don't have the enzyme to break it down efficiently. And it's a similar thing with gluten. In gluten, there's a few compounds that need to be broken down specifically by the body. And again, sometimes in our bodies, we just find that a little bit hard to do. And so that can cause a lot of inflammation in the body. Of course, things like excess sugars. Poor sleep is another reason why we can sometimes have high inflammatory markers in the body. Sleep is really recuperative and restorative for our bodies. It puts us into rest and digest mode, which really brings down all the stress markers and the inflammatory markers in our body. So poor sleep, which is very common with our modern lifestyles, can really drive inflammation back up again, and the body never gets a chance to reset. Things like being exposed to lots of toxins. So as I said, if your immune system's being exposed to toxins all the time, it's constantly trying to fight off this perceived threat. And so it's constantly in a state of high alert in your immune system. So as much as dietary foods can do this to us, also that we're exposed to a lot more chemicals and pollutants and toxins in everyday life. So even things like the products we're putting on our skin, on our hair, our makeup, if these have got chemicals in and toxins in, this can cause an inflammatory response in the body. If we're using chemicals to clean the home, that can cause a reaction. When we go outside, there's air pollution, there's pollution in the offices, in the places where we work, the places where we shop. So this constant barrage, again, of toxins on the body can cause a raise in inflammation. It can make it very difficult for the body to get back into this rest and digest mode. Some medications can also cause inflammation, so it's worth being aware of not just the medications that you're prescribed by your doctor, which obviously you need to be taking, but just to be aware that they can inflame certain parts of the body. But also, we've become a nation that likes to self-medicate. So we'll go to the chemist and we'll pop a few paracetamol on a regular basis with a headache or an ache or pain. But these medications over time can also cause inflammation on the body. We're not meant to be having these drugs in our system for these prolonged periods of time. Smoking is another big one that can cause a lot of inflammation and stress on the body. Alcohol, so excessive alcohol use. And also having a sedentary lifestyle can also drive inflammation in the body. So there's quite a lot of reasons why our modern lifestyles can really be like this perfect storm for creating a lot of inflammation in the body, which is then driving a lot of our chronic conditions that we tend to think of now as our normal. So what's actually going on in the body when we've got this kind of inflammation? So what's happening is when there is this kind of inflammation going on, first of all, in the blood vessels, for example, this inflammation can build up. It creates a lot of products in the bloodstream that sort of like plaques and things that can really sit in the arteries and block the arteries. And this can raise our cholesterol. It can raise our risk of heart disease. It can raise our blood pressure. So inflammation can really directly impact our cardiovascular health. Also, if you've got inflammation in the gut, that can cause things like leaky gut, where the actual digestive tract of the gut is inflamed and it opens up a little bit and it lets toxins and things from our food directly into the bloodstream. And this can cause a lot of food intolerances, a lot of IBS type symptoms, even things like migraines it can cause, and aches and pains and arthritis. So again, inflammation in the gut can cause a lot of issues. If you've got inflammation in your cells of your body, and of course we've got trillions of cells in our body, when these cells are inflamed and there's inflammation going on within all these cells, the signaling and the messages between the cells don't happen as efficiently as they should. And then you start to get a breakdown in the communication between the cells. And that leads on to an issue with things like insulin and processing sugar in the blood. So that will obviously increase our risk of diabetes. It can cause joint pain, inflammation around the joints. It can cause things where the mitochondria within our cells are not working as efficiently as they could do, and therefore we get fatigued, we don't have good energy. It can also affect sort of the DNA synthesis within the cells. So things like cancer becomes a bigger risk because the cells aren't dying off efficiently, they're not regenerating efficiently, and when they are regenerating, they're coming up with mutations and things like that. So inflammation can drive all these different things and cause a lot of knock-on problems within the body. Okay, so what can you do to reduce inflammation for yourself within your body? There's actually a lot that you can do. So the first thing I would say is if you're smoking, stop smoking, because we know obviously there's so many different health benefits of stopping smoking, but particularly with regard to inflammation, stopping smoking is going to be a really big one. If you're drinking excess alcohol, more than sort of 1 or 2 glasses a week, you should really be cutting that back, because again, this is driving inflammation throughout the body. It's increasing our triglycerides in our bloodstream, it's increasing our cholesterol, it's increasing our inflammatory markers. So alcohol is another big one that you want to try and reduce. With regards to your diet specifically, cutting out as many processed foods as you can. So removing the foods with all the toxic fats in, with all the chemicals in, and all the additives in, that's going to bring down the inflammatory load in the body significantly. If you want to take it further, then I would definitely recommend removing dairy and gluten, even if it's just for a couple of weeks to a month, just to really see how that impacts the body if you notice an improvement in your inflammatory symptoms. So, for example, things like arthritis and acne and psoriasis, all of these can be really driven by dairy, even IBS. So if you're having sort of those kind of issues, removing dairy might really bring down that type of inflammation in your body. Removing excess sugars, excess gluten, removing all the vegetable fats. These fats are really, they're high in a fatty acid called omega-6, and this is really pro-inflammatory in the body, and this is what we need to be getting down. So removing all those processed foods and the vegetable fats is gonna really bring down the omega-6 load on the body. So it's gonna be reducing that inflammatory load on the body. What do you want to bring in instead? So you want to bring in lots of omega-3, which is your anti-inflammatory or healthy fat. So things like your oily fish, olive oils, nuts and seeds, your olives, things like this, the avocados, they're all full of really healthy fats that actually have an anti-inflammatory impact on the body and will reduce the inflammation. So lots of omega-3 fatty acids in your diet from those sources is going to be really beneficial. Another thing you could look at doing is increasing your fiber intake. Again, we know that fiber is just so beneficial for gut health and for your microbiome. And in turn, that is going to help to reduce any inflammation in the gut. And that's going to knock on and help hopefully reduce inflammation systemically as well. And again, things like fermented foods, again, because they've got the live bacteria and that can support a healthy microbiome and therefore bring inflammation down within the digestive tract. So that's things like kimchi and kefir, kombucha, yogurt. All those lovely things can be really beneficial. So trying to increase those foods will also help. Other things that you could do is you could look at reducing your toxic exposure, or what, aside from your food. So looking at things like, can you use more organic and vegan products in your skincare? Can you phase out some of the products you're using and put more natural products in? And the same with your cleaning products. If you're using lots of cleaning products and you're breathing in those fumes every day, that's not going to help the inflammation within your body. So trying to reduce the toxins in your home, on your skin, in your skincare, even, when you're outside, trying to get lots of fresh air can be really helpful as well. And addressing your lifestyle. So you really want to be looking at reducing stress wherever you can. And I know for a lot of us, that's easier said than done. But following a plan, having a routine, knowing from one day to the next, things like where you're going to be, what you're eating, being organized, eating a healthy diet, having a plan in place and having that routine is really going to help to reduce stress and therefore reduce inflammation on the body. You also want to do things like like moving, you know, so yoga and Pilates and things like that are really great. Your hardcore, like cardiovascular workouts are probably going to increase the stress and cortisol and therefore the inflammation in the body. So if you're looking at reducing inflammation, you want to be looking at the much more sort of gentle movements that don't really spike your heart rate too much. So things like yoga and Pilates are going to be really good for you here. Walking, getting outside in nature. If you can cope with it, walking barefoot on the grass and on the ground and earthing is a really good way to reduce stress on the body. Breath work is another one. So if you can do some proper, you know, lovely deep breathing exercises and really sort of focus on your breath work a few times a day, again, that can really help to bring the body back into balance, back into that rest and digest phase, and that can really help you. Again, looking at sleep. So anything you can do to improve your sleep is going to help to bring down your cortisol, bring down your stress levels, and of course, bring down inflammation. So maybe you can establish a really nice sleep routine, having a warm bath, using some Epsom salt, using some magnesium lotion on the body, having a herbal tea, using scented oils like lavender. All these things can really help. And also trying to avoid stresses in the evening, you know, just before you go to bed. So maybe instead of watching that high intensity drama, you know, at 9 o'clock at night, put something on that's a little bit more relaxing to watch, and that's going to help to calm the body down. Trying to schedule some time in for self-care can also really help. So trying to, you know, make sure that you've got that downtime, that me time, that time to breathe, time to relax, time to take stock and feel organized and sort of clear your mind can be really helpful. So it is definitely worth looking at ways in your lifestyle that you can support stress and therefore reduce inflammation and reduce your exposure to things that are going to cause inflammation on the body. If you want to think about some supplements, I have got a few supplements I'd like to suggest that you think about. As always with supplements, please check with your doctor or another medical practitioner before you start any supplement, especially if you're on any medication, because sometimes they can interact with each other. So do be aware of that, and please do research before you take anything. But if you wanted to look at supplements, I would recommend ashwagandha. It's a lovely supplement to help balance cortisol, bring down stress, and therefore inflammation. Obviously, an omega-3 supplement here, a really good quality omega-3 supplement can do wonders to bring down all those inflammatory markers in the body. So if you're not one for eating lots of salmon and olive oil and avocados, you know you're not really getting enough in your diet through, you know, through your food choices, then a really good quality omega-3 supplement could be a good option for you. Prebiotics, again, to support that gut health, you know, extra fibers to really sort of help your gut and to reduce any inflammation in the gut. A good quality multivitamin would always be a good idea. That's to make sure that your body's got all the cofactors that it needs to bring down these inflammatory markers and to combat any stresses on the body. And then you've got some calming adaptogens that you can bring in. So things like lemon balm and GABA, which can really help to sort of calm the mind, especially if you're like something that's being driven by anxiety. They can be nice supplements to think about. But again, please check with your doctor just in case you're on any medication and there's any kind of contraindications that may mean that it's not really appropriate for you. So I hope you can see that there's lots of different reasons why we should be addressing inflammation and stress in the body. And there's a few simple tips that you can implement to hopefully reduce inflammation and reduce some of the chronic conditions that maybe you're suffering with.